Hello, my name is Cecilia Mwasa, and this is my presentation on Health Promotion Unit 18. What is health promotion? Health promotion is a public approach based on the idea of promoting and encouraging individuals to live healthier, fitter, and more active lives. It also serves to equip individuals with the necessary information to avoid diseases and resulting consequences. Health promotions are very beneficial as there is an awareness of preventative measures of illnesses and diseases. In England, Wales, and Scotland and Northern Ireland, health promotions can differ based on strategies and aims, but the key principle and focus is on promoting good health and resulting in individuals taking control of their own health. Health promotions are useful tools in reducing the pressure on the NHS. Many people will take up the NHS services for minor illnesses that can be self-treated through rest or simply by buying over-the-counter medicines at a pharmacy. An example of this is the annual flu campaign in England. This serves to encourage people to take up flu jabs in order to reduce the risk of sick people in hospitals with illnesses related to influenza. Here are some of the examples in which health promotions has been successful in mental health, diet, exercise and obesity, alcohol and drugs, HIV and sexual health. Campaign for Life was an England-led health promotion campaign which was launched in 2009. It was the first national social marketing move on tackling obesity and health issues it causes. Childhood obesity rates were on the rise at worrying rates, and therefore the Change for Life campaign was launched to tackle childhood obesity, as well as encouraging families to make healthier choices. The original purpose of this campaign was for childhood obesity prevention. The demographics of this campaign were children in the ages of 5 to 11, especially those whose families or parental beliefs, attitudes, and behaviors suggested that their child was at a higher risk of becoming obese. The Campaign for Life was split into 4 stages, and these were alert, motivate, support, and sustain. Campaign for Life was hugely successful. It was getting positive reactions from most of society due to its keenness and drive to encourage a healthy lifestyle and prevent childhood obesity. In the first year, over 400,000 families signed up to the Change for Life campaign. It exceeded its targets by reaching over 99% its intended goal. Millions of families joined in its first year. Responses through the post, online, face-to-face, etc. exceeded 1.9 million in 1 year. In January 2010, a new sister brand, Start for Life, published materials for adults with very young children, and in February, a different program for adults in their 40s was published. Because of the success of the original Campaign for Life, was able to expand and cater to other demographics within society. In terms of society as a whole, the engagements were beaten and over 1.9 million responses were received to the campaign. The campaign was clearly successful as it was used by many families, and collectively the campaign was able to promote and collect data and results. Better Health was another public health England-led initiative and was launched in 2020. The idea behind this campaign encouraged adults to make better life choices regarding their health by losing weight, getting active and quitting smoking. This campaign was launched during COVID-19 pandemic, as data was suggesting that obese people were more likely to fall seriously ill from COVID-19, ended up being hospitalized and even admitted into intensive care units compared to those with a healthier BMI. The Better Health campaign had a slogan, "Let's do this." This campaign was launched during COVID-19, and this slogan was meant to encourage people who had been inactive due to subsequent lockdowns that followed when COVID-19 was first announced in the United Kingdom. Better Health campaign had 4 main goals, and these were: lose weight, quit smoking, get active, and drink less. People were encouraged to get healthier, and information could be accessed on the NHS website. There was an NHS weight loss plan app, NHS quit smoking app, Couch to 5K app, Drink Free Days app, as well as using social media promotions and releasing facts and supporting information on various NHS websites. Better Health had mixed reactions on its means of encouragement and at the timing of its launch. However, it was hugely successful, and many other organizations like Age UK and British Heart Foundation supported and reshared this campaign on their platforms. 43% of individuals felt motivated to make health choices by January. 39% adults committed to losing weight. 4 in 10 regular smokers planned to quit. The campaign reintroduced a year later after the original launch due to its success. Because of the increased spread and awareness of this campaign through social media, radio, and also with over 2 million app downloads, the Public Health England campaign have found 6 benefits that linked straight to individuals. These were a decreased risk of common cancers such as pancreas and liver cancer, lowered risk of increased blood pressure, reduced risk of heart disease, less risk of developing diabetes, less joint strain and back pain, decreased risk of serious hospitalization due to COVID-19. My named campaign is called It Starts with the Heart, and it starts with the heart, and the purpose of this campaign is to raise awareness on heart circulatory diseases, making lifestyle changes in order to reduce risk of contracting certain heart and circulatory diseases. Resources chosen for this health promotion are Instagram story posts that can be shared on platforms through advertisements. When choosing how to promote this health promotion, it is important to consider that 7.6 million in the United Kingdom are living with heart or circulatory related diseases, and therefore having smaller groups in the community would be an adequate way to promote the risks related to these diseases. Therefore, I have chosen the mass approach. It is a way to provide information to people gathered together that don't belong to a specific group. This approach can spread and share information on mass level, such as national or citywide approach. One disadvantage of this type of promotion is that not everyone who receives and views the campaign and information will apply it, which can reduce the effectiveness of the health promotion on individuals. Mass media is usually distributed to reach a large number of people very quickly. Some platforms, this type of information can be distributed on television, radio stations, newspapers, and social media. Different resources can be used for a health promotion campaign depending on how it is to be shared and also what topic regarding the health promotion is. Resources I'll be using for my health promotion are social media platforms, social media posters and story highlights, paper posters to be published in NHS and trusts and GP practices, billboards on buses and busy city areas. Furthermore, using these particular resources, this is how I'll be promoting and advertising my own health promotion. The media I would use is social media and also physical billboards, posters, and the choice of media would be single posters that could be viewed both online and through social media and also physically in GP practices as well as on billboards and posters. This health promotion will encourage individuals to make changes such as quit smoking and reduce their alcohol intake. Therefore, the best time to release this health promotion I suggested would be the beginning of the new year, as this is a particular time where most people want to make changes in their lives. The duration of this health promotion campaign should be longer than usual, as it is important to highlight the importance of heart and circulatory diseases and the risk factors linked to them. The duration should be around 6 months, and if we start in January, therefore should end in June of the same year. The health promotion activity will be looked at in the perspective of ecological model theory. The core premise is to look at the influence on various levels such as interpersonal, biological, and physiological. The ecological theory provides comprehensive framework for understanding variables of health behavior. Excuse me. The different variables of the ecological model are interpersonal individual elements, organizational factors, community factors, and public policy factors. This model is effective in being able to look at a wide range of factors affecting an individual's health and happiness. Depending on the scale of the health promotion, ascertaining the outcome and effectiveness can depend on resources used. One effective way to determine the effectiveness of this health promotion activity would be an evaluation. The evaluation would need to be written up and chosen before the health promotion is released, and then could be referred back after the launch and completion of the health activity. Describing the program for an evaluation and also previewing the evaluation with directors, stakeholders, and those involved within the program should be able to determine effectiveness with each other's ideas. 6 different evaluation techniques. The different evaluation techniques would be focus the evaluation design. The effectiveness of an evaluation relies on the strength of evidence gained and the data sourced back from the health promotion. Process evaluation and impact outcome evaluation are two main methodologies that are mainly used to process health promotion activities. Both strategies are usually required. Each methodology is crucial to gaining insight on effectiveness. Process the evaluation. Processing the evaluation is looking at everything within the health promotion on the program's delivery, the levels of traffic gained, and any potential emerging problems to whether the program was delivered as planned or changed to accommodate arising issues. Impact outcome evaluation. This evaluation captures the short and medium term impacts, as well as its long-term consequences, which are known as outcomes. Choose the appropriate method for data collection. In this area, the health educator must assign roles on the delivery resources on health promotion. This is all about maximizing on intended audience and how to best reach them. Determine how best to analyze data and interpret results. This is all about how to understand data and what techniques are used to break down the data captured during the health promotion. Describing the data analysis techniques and computer software used, asking for assistance in breaking down data and understand it. Disseminate lessons learned. This is all about learning lessons and what went well and what could be improved. It is also about whether that is training others, publishing reports to be viewed when planning other health promotion. This evaluation can determine how successful our health promotion would be and what we could do to improve if we were to relaunch this particular promotion in the future. Thank you very much for listening.